So I know in your practice, you do general dentistry, cosmetic dentistry, sedation dentistry, restorative dentistry, Botox, everything you can think of. So kind of, I know what general dentistry is. Well, I don't know what general dentistry is. I go to the dentist generally, but on my regular scheduled visits and stuff like that, the preventative care, all that good stuff.
Yes.
So I'm kind of familiar with that aspect. Can you kind of just give me a brief overview of what the general dentistry is, the aspect of that?
General dentistry is just, your cleanings, your fillings, dentures, partials, just, regular general dentistry.
Yeah, for sure.
Yeah.
All right, so let's just move right on to talk to me about, I guess cosmetic dentistry. So that's interesting as well. So tell me a little bit about that. What does that include, cosmetic dentistry?
Cosmetic is something that you're doing by choice. Like, it's not necessarily something that you need. It's just something that you want. Like, people don't need teeth whitening. You do teeth whitening so you can have a pretty white smile. It's not something that, if you don't do it, then your teeth are going to rot out or something like that. So teeth whitening, veneers, crowns, stuff like that.
Okay. I guess, speaking, I got a question definitely in regards to the veneers, but in like the other stuff, I guess, what's something that's trending that you kind of do, one of your most popular cosmetic procedures?
Veneers and teeth whitening.
Veneers and teeth whitening. Mm-hmm. Why would you say, I guess it's trending.
Everybody's want that. They want that popping white smile. They want the baby smile. They want that love and hip hop Atlanta smile. Everybody wants those pearly whites.
Okay, and I would say, what age group would you say the teeth whitening or the teeth whitening or veneers would you see most prevalent amongst?
I would probably say late 20s to 40s, probably.
Okay, yeah, that's interesting. I guess this particular age with the social media or the digital age, I would say that would be the biggest part. So. Just speaking about it, veneers in general, I know they don't come in sizes. So I've seen all shapes and sizes of veneers. And veneers, from what I've researched, they date back years and years, hundreds of years, or at least 100 years for sure. So I guess the popularity of the digital age and pictures and all that good stuff has made it more trendy to have the perfect smile. So kind of expound on that. What would actually, because I know 20s to 40s, normally that's not the age men I would think in my mind envision a person trying to get veneers or something like that. So can you kind of expound what would be the normal recommended age? 'Cause I know the veneers that don't last but for a certain amount of time. Is that correct?
Well, it's not a particular recommended age. It's just like I said, it's cosmetic. So it's something you don't need it, but you want it. So you get it when you want it. If you got the coins, then you get it.
Yeah, for sure.
So people get them for different reasons. So a lot of it is time. So a lot of people have, spaces in their teeth or a little bit, malaligned teeth, and that they don't want to go through orthodontics, so they get veneers. Or if they've got some chipped teeth, they don't want to, cut down their whole tooth, they get veneers. Or if they've got some stain and discolorations in their teeth that can't be fixed with teeth whitening, so they get veneers. Or they just want to be extra and do what everybody else do, and then they get veneers. So it depends. Different people have different reasons for getting veneers.
For sure. Now, they don't come in sizes, correct?
Well, no. Yes and no. Okay. So you can't just, here's a veneer size, but I want those. That's not really how it works. Like if your natural teeth are more so square type teeth in shape, then more so your veneers are going to be square. You can change them a little bit, but it's not going to be drastic. Otherwise, you would look like horse teeth. It just depends. It just depends.
Yeah, I've seen some that I'm not to on TV like from different celebrities. They kind of look a little bit extreme. You know what I'm saying? So. But it's just funny to see. So, but they're meant to kind of fit your teeth. How long do they last in general? Or do you all still do preventative care while they have veneers on the actual natural teeth?
So veneer is just that, if you put a veneer of paint on something, it goes over something. That's exactly what veneer in dentistry means. So veneer can be porcelain or veneer can be composite resin material. It goes over your teeth and it's bonded to your teeth. So once it's bonded to your teeth, it's bonded to your teeth unless it comes off. Sometimes you can do them without shaving down the teeth and sometimes you cannot. But like once it's over your teeth, it's not something like, oh, it's on my teeth today and tomorrow it's just going to be off and my teeth are going to be the same way they were before I got them done. It's not the case. A lot of people make it seem that way, but that's not the case.
Okay, so you still have like the maintenance on the natural care of the teeth.
You still have to, you still have your gum health and things like that. You have all your other teeth that are not veneer. So you still have to come in for your 6-month, maintenance cleanings. You still need to, sometimes veneers are very, very, very thin. So if you have like a clenching or a grinding habit, then you can pop your veneers off frequently. So a lot of times a dentist will recommend a mouth guard for you to wear after your veneers are made if you have that particular type of habit.
Okay, yeah, that's interesting.
Mm-hmm.
All right, so I guess talk to me a little bit about sedation dentistry. I guess it's just putting you to sleep and then going to work, right?
There's different types of sedation. There's oral sedation, there's general sedation, there's conscious sedation. There's different types of sedations. So there's one type, general sedation, like being put to sleep means like you get IV in your arm, you get the tube in your down your throat, like you're out.
Oh, wow.
Okay, that's generally, hospital-based type of sedation where they do that for kids. So say you have a young kid that's, 3, 4, they have a lot of work that needs to be done in their mouth. Most times kids are not cooperative. So they go under general sedation in a hospital-based type of arena.
Okay.
So that's where you like sleep. Like you don't have control of your reflexes, you're out. Then you have IV sedation, or which is kind of like comprehensive or conscious sedation, where they put a IV in your arm and give you some medicine through your IV, and you're kind of like, you're aware, but you're like not aware. You can still control your own reflexes and things like that. That's IV sedation. You have oral sedation, where you take a pill and it just kind of helps you with your anxiety, kind of gives you, a woosah, calming type of effect. You'll take that, an hour before your appointment. You have to have a driver, and they drive you to the appointment, and you just chill. And then there's like sedation with the gas, which is nitrous, where you breathe in some gas and just kind of helps you calm and relax. So there's different spectrums of sedation.
Okay, yeah. Well, no, that's interesting. So with you see all the funny videos like that you may see on social media and stuff like that. What kind of sedation are those people using?
Most of the time it's IV sedation.
Okay, IV sedation.
Or nitrous.
Okay.
And how people react differently. So that's why you see some people react really, really funny. Some people are like, chill. Everybody reacts different.
Okay, that's interesting. All right, so with that, like what type of patients do you kind of utilize or do the sedation for? Like what's a trending?
Anxious patients. I have a lot of people who are highly fearful of the dentist. They don't like the sounds. They don't like the feeling of it, of anything. They don't want to be really aware of what's going on. They hate getting shots. So for those type of people who are, highly anxious and, fearful, they're the best candidates for sedation. Or longer type of procedures. If you want to do a lot at one time, then sedation is a good option as well.
Yeah, no, that's interesting. Is there like a certain particular group that you may see more, maybe more males do sedation or more females do sedation, or just random?
It
could
equal.
Be anybody.
Most people are afraid of the dentist. I mean, it's everybody. Everybody, do you do nitrous? You got nitrous? Everybody, people don't like the dentist. It's just,
No, that's
I can understand it because I don't like getting my teeth scraped on, either. So I definitely understand it.
No, for sure. All right, so I guess restorative dentistry, is that kind of what the cosmetic?
Restorative just means just restoring something. Like you can restore missing teeth. You can restore like of a decay. You're gonna restore the tooth after you take the decay out. It's just a term.
Just kind of building it back up.
Mm-hmm.
And I know you do Botox as well, right?
Mm-hmm.
So that's something I'll commonly associate with dentistry.
You should, because dentists are the head and neck specialists. We learn all the muscles and arteries and veins and such in the face. We're the prime candidates to do it.
So tell me about it. Tell me why, because I don't know nothing about that. This is like for yourself being hearing that you do Botox at the dentist office. That's just interesting to me because I've never heard of that before. So maybe I just go to an old-fashioned dentist. I'm not sure if that's a common thing.
It's a personal preference. Like I was telling you, I like everything beauty, confidence, health, and wellness. So if I can do something, A, I like it, and B, if I can do something to help somebody else, then why not? And also, so Botox, if you want to delve into it,
please do. Tell me first, can I kind of explain what it is?
Okay,
yeah, basically.
So Botox is a brand name, actually.
Okay.
So there's Botox, there's Xeomin, there's Dysport, there's Juvo. What it is it's a protein made from botulinum toxin. Okay. So
I'm not even okay. You can explain it if you like, but
so botulinum toxin, what it does, the protein that's used in all those materials, what it does is that it paralyzes muscles. So if I raise my eyebrows, right, there's a muscle that's allowing me to raise my eyebrows. When I raise my eyebrows, those lines form because the muscle is moving and the skin is above it, right?
Yeah.
So if you do Botox to that or Xeomin, whatever botulinum toxin you want to do, if you inject that toxin into that particular muscle, it blocks a receptor so that muscle cannot move. Okay, right? If that muscle can't move, I can't form those wrinkles that are right there. So then it's smooth.
Yeah.
So that's how Botox works.
Kind of keeps you young, I guess.
Keeps you young and smooth, and you don't have those wrinkles. Or if you smile, when I smile, some people, not me, because I'm Botox, but some people, when they smile, they get these little lines that come around there. Why? Because there's a muscle that goes all the way around our eye, orbicularis oculi. I know that because I'm a dentist and we learn all the muscles in the face. But that movement of that muscle makes the lines bunch up there. So if we put a little Botox around there, it keeps those little crinkly lines from starting up, and then you look young. But there's also dental implications for that. So people who suffer from TMJ pain or they clench or grind their teeth, if you put your hands here and you clench your teeth, come on, go ahead and do it for the viewers. Put your hand here and clench. You feel that muscle popped out when you clench? That's called the masseter muscle. So that muscle controls how much you can clench or how much you can grind your teeth. So if we put some Botox in that muscle, it makes that muscle not be able to contract as much. You're not clenching and grinding as much. You're not waking up with headaches and migraines and things like that. So that's one dental implication of it. Or some people, they smile. Like me, I show a lot of gum when I smile. So if you put a little drop of Botox in their muscle that's there, you don't smile so big. You don't have so much of a gummy smile. So that's a dental implication. So if you're doing, crowns or veneers and you don't want somebody to see all the line there, you can do some Botox. If you want to show more lip, you can put a little. It's just so many different implications of, how you can use Botox for not only facial aesthetics, but for therapeutic as well for TMJ pain and teeth grinding and clenching.
Yeah, no, that's interesting. I just thought Botox was a particular surgery. I didn't know it was actual protein or anything like that. I just say, okay.
And it's not actually a toxin that you're putting in there. It's the protein.
It's the Okay. No, that's interesting. And you say even yourself, you utilize Botox.
I do. A lot of black people think that their black don't crack. Well, I'm going to make sure, not too much, but, just a little bit.
Put the plastic cover on
there. A little bit here and there,
Nah, I feel you. So, is there, I guess you said paralyzed, that kind of makes me nervous from what you say. The procedure's probably fine, but I'm just saying in general, just the phrasing of that term. So what kind of effects would it have long term, since are you not able to use that muscle anymore ever, or does that go away?
It goes away. So it blocks the receptor, the acetylcholine receptor, if you want to get fancy and scientific, but new receptors form. And so in 3 to 4 months, that it wears away and you get the movement back. It may be a little bit decreased movement, but you still get some movement back. So people who get Botox, they have to get it done every 3 to 4 months. So it's a maintenance type thing.
Oh, okay. Mm-hmm. No, it makes sense. Definitely makes sense.
But there are side effects of it though. If you get some material in the wrong place, so say, you're putting Botox in this area here, where this muscle goes all the way around here, and there's a muscle that goes this way. So sometimes if the material gets to where it doesn't need to be, you can have the drooping of the eye, or you can be too surprised. So you've seen people who they look like that. So there's different things that can happen, but it will go away in about 3 to 4 months. And also, we're sticking needles in your face. You can bruise, you can, bleed, swell, different things like that, because you're getting a needle in the face, in the skin. So there's different things that can happen because of.
Yeah, no, it sounds like a very serious procedure for sure. Mm-hmm. Definitely. Kind of throws me. I'm just kind of in awe. Just
you want some Botox now, don't you?
I'm not.